get to hear from our superstar panel today. So I'll allow our panel to properly introduce themselves, but delighted to be joined by Sam, Geeta and David. We are going to be covering in the next 30-40 minutes or so. We want to talk about system leadership, we want to talk about purposeful collaboration. If anyone can find a way to shoehorn in a question for Sam on her labradoodle, we'll be very grateful. Likewise, if anyone wants to ask David about the finer points of New Zealand geography, we can do that as well. But what I'll do is I'll pass over to our panel, first to Sam, then to Geeta, and then to David. And I wonder if you wouldn't mind just introducing yourself and just saying a little bit about what driving purposeful collaboration means to you and why you think it matters in a system like South East London. That would be lovely. Sam, I think you're going to kick us off. Good evening, Sam.
Good evening. Hi, I'm Sam Hepplewhite. I used to be the Borough Director of Southwark as part of South East London CCT, but I've moved over to work on primary care and the COVID vaccination programme. But it's still lovely to see you all. So I had a little think about what does driving purposeful collaboration mean for me? And what it means for me is slightly letting go. It means it's not me that's needing to drive everything, not me supervising everything, but actually listening to other people, learning from other people, just having time to recognise their strengths and the uniqueness that they bring to a situation. I've learned so much from just doing that, especially during the last 2 years. It has been a revelation to me, and I have feeling so much more comfortable. When we go back to that first question we just had about how confident I feel, I'm feeling much more confident having let go and not felt that I'd had to control everything in the last couple of years, at a time when actually that's all you wanted to do was bring things really close to you during a pandemic. So that's me. Rich.
That sounds lovely. Thank you very much indeed. I'm sure we'll come back to those themes as we go through. Let's come to Geeta next. And Geeta, you have to tell us where you are. And I think it's worth us just being able to say that, Geeta, you're joining us from your holiday. This is, you're not just not in the UK, you're on holiday. We are incredibly grateful. Thank you so much.
Thanks, Rich. So hello, everybody. So yeah, Rich is right. So I'm in India on holiday, and but I just, when Jonty asked me, I just felt it was really important for me to come and, talk to all of you. I'm an ophthalmic surgeon by background and postgraduate dean for South London. And purposeful collaboration for me starts with saying yes to the mess. So, Rich said it's all about complex problems, right? So you're saying yes to the mess and then starting out that journey. It's about, like Sam said, the fact that you're not the sole person in charge. You're letting go. You're actually making sure that you don't have all the you don't have all the right answers. It's about actually understanding that it is up to all of us. So, getting the stakeholders to recognize that collective responsibility to address the challenge themselves, and trying to get that North Star in place, because, that's what we need to actually have in purposeful collaboration. What you really need is that North Star that you're going to follow through and find a way in getting as far as you can together. And Jonty said that in his, in his talk. He said flattening that hierarchy, and that is hard work. That is really hard work, but that's what purposeful collaboration for me is about.
Geeta, lovely. Thank you very much indeed. And that North Star to follow, again, I'm sure we'll be coming around to that, and just the importance. It is purposeful collaboration for a reason, being really clear as to what you're trying to succeed in with collaboration at the heart of being effective. Last but by no means least, good evening, David. David, thank you so much for joining.
No, not a problem. I'm David Mates, and previously the Chief Executive of the Canterbury Health System in New Zealand. And for my sins, ended up taking over probably an exemplar system of dysfunctionality, brokenness, disjointedness, and all of those different elements. And well, I guess purposeful collaboration for me means being really clear about the why. Not that obvious sometimes why you need to collaborate, and we often assume that the blindingly obvious is blindingly obvious, and often it's not. And we're so often anchored in, we work on the assumption that everyone understands they're part of a system, and it never ceases to amaze me that actually most people don't understand. They're part of a tribe that might be called a hospital, or might be called general practice, or might be called social care, but they don't necessarily identify them being part of a health and social care system. So I think one of the things there has been really clear about the why, and not assuming that everyone has the same vision. And I think a couple have already mentioned that, kind of the sense of the North Star. We started off with a really simple vision, and really simple vision. It's a health system centered around people, a connected health system centered around people that aims not to waste their time. And that became the anchor for a system in terms of the why and the purpose, and a sense of something that people could see themselves all reflected in. It was important for them. They could see they were part of a system, and what their part and place was within that system. But I do get nervous with the words collaboration. It's a bit like innovation, is that actually everyone has to collaborate and everyone has to innovate. And I'll just take you back to the global financial crisis, where was the beauty of innovation that just about ground the world's economy to a standstill. So again, it's that bit is actually collaboration without it being purposeful can do a lot of harm and damage. And then there are just a couple of barriers that that you kind of talk about collaboration, and then we put up all the rules, the contracts, and the funding, but then actually tell you why you can't do it. And so the other bit to purposefully collaborate also involves needing to change some of the mechanisms within the system, actually to support and enable and reward collaboration.
David, lovely. Thank you very much indeed. And Geeta, Sam, lovely way to start as well. Thank you. A couple of points from me, and then we'll get straight on into exploring this a bit further. Firstly, thanks for those who are already sharing reflections in the chat. Please do continue to do so. And we'll pick them up during the discussion as we go through. So please do feel free to use the chat as we go through. Again, just to say that we are going to be sharing lots of content resources back on the microsite. So if you're sitting there thinking, oh, I've got a colleague who would love to be here, well, fear not. You can. There'll be lots to share with them afterwards. So I think we're going to pick up, I think, actually the theme, David, which you've raised, but I wonder if we can go back to Sam, Geeta, and then David again, just in terms of, I'm sure a number of people are sitting here going, oh, okay, all right, well, this sounds great, but we work in a system where partners have different priorities, they've got different cultures, they're operating in different contexts. Oh, this sounds difficult. So really interested in panel's views. So let's start with Sam, then Geeta, then David again, if that's okay. Really interested in your views, but how do we create a culture that supports collaboration in a system where there is still going to be difference, but we need to try and find that common purpose? Sam, do you want to kick us off?
So I think the first thing is that we have to accept that we are in a system that hasn't, and as Geeta said, it's messy, and we have to be a little bit comfortable with being uncomfortable with that mess. And not everything is going to change overnight. We've been in, as Jonty said earlier on, we've been in this system for a number of years, and we've got some learned behaviours from doing that, and some of that has got to be unlearned. I would say though, that I firmly believe that a culture is not developed from a board development session in Tooley Street. I think the culture of an organisation is developed by the people that are part of that organisation. And I think there is something about us as staff members taking, yes, obviously we need a vision, as David said, to work to. We need to understand the values of the organisation, but I think we can probably guess what they're going to be, because we all know enough around what the priorities are, and the way that we want to work. And I think there's something about getting on with it, using every opportunity that we have as individuals and teams to work in that way. And it's our job to develop the culture that we want to work in. That's what we're here to do. So that would be my starting position.
Sam, thank you very much indeed. I'm afraid you've given the wrong answer. Culture is actually created in board development sessions in Tooley Street. That's a well-known fact, known throughout the...
Please don't let Andrew and Richard know I said that. This is being recorded. It could be the end of my career in South East London.
People will point back to this recording for years to come. Sam, lovely. Thank you very much indeed. Geeta, do you want to pick up the thread, saying yes to the mess? Such a wonderful way to come into this sort of the situation we're all working in.
Yeah, I think, Rich, that the problem we sometimes have is that we look at a problem and then decide that we need to create a solution. And that's, I think one of the things that comes to mind is the vaccination scenario that broke out with where, the answer to COVID was everybody needs to get vaccinated. And if healthcare professionals didn't get vaccinated, they would all be fired. You see? So that was how and you saw what a messy issue that actually led to. So I think the idea is that what you need to do is, first of all, get your team together. The team is really important because, building a great team is much more important than perfecting your idea. As Jim Collins says, you need to get the right people on the bus. Once you get the right people on the bus, sitting in the right seats on the bus, then you're actually able to get through that journey, because culture is something that is not very easy to change. It doesn't change in a day. So you need to be ready for that long haul. You need to be ready to make sure that, everybody who's on your team is there. And, like I said about that North Star, that they're still going to be following the North Star a year down the line or 18 months down the line when you're still trying to make the change happen. The other thing to remember is that, we don't often think at a system level. We think at an organizational level. We need to find out who can do our heavy lifting. Where's that coalition of the willing? Where are the found pilots? Now, this found pilots is a theory that I got from the Howard Macy Institute when I went and did a course there. And what they mean is that there are already good things happening in certain areas. So you need to find where those found pilots are when you're trying to actually, make things like a cultural change. And what is the influence? Who are the people who are influential enough within the system who can actually help you, who can do that heavy lifting for you to move forward? And don't forget that you can have influence wherever you're in the system as well. So it's not just about others, it's about you. But just making sure that you are aware of the fact that, your job is not to rush to answers. It's about asking those questions, making people think, and experimenting and learning from mistakes. The mistakes bit is also important.
Geeta, thank you very much indeed. And David, you were saying that you started with a dysfunctional system, so I imagine sort of mess is sort of quite well known to you.
Oh, a mess is the best place to be. Because actually there's only, you can actually bake some wonderful cakes with the ingredients from that. But it is interesting, kind of, today you've woken up and someone says, well, actually collaboration's the in thing, but you've spent the last couple of decades eating each other and fighting and competing over resource. And so it is an interesting bit in terms of how you deal with the, kind of the historical incentivization to compete versus, and much of the mechanisms in place still reward competition and still reward single point accountability, as opposed to actually how do we incentivize or reward collaboration? And one of the things I see missing at the moment is actually those mechanisms that actually make it safe to collaborate. And in many cases, it's still safer to do nothing, because actually then it's not my problem. and I can blame someone else, and there's not enough resource or anything else. The other just observation is change happens at the speed of trust, and that comes down to the basis. If you're going to move and do something, actually you need to have an environment where trust exists. And I think one of the challenges for all of us as leaders, and that's talking to everyone in this room, is we've got to be making sure that we're modelling the behaviours and the environment that actually we want our teams and staff to work within. And I think probably still the most fundamental thing for leaders to do is to create that environment to enable others to flourish. And too often it's so easy seeing, great vision, wonderful, we need to collaborate. And then you see the behaviours of the leaders within organisations modelling something quite different. And then you kind of wonder, well, why, why would you, kind of collaborate? And the other bit is, if you're wanting collaboration to flourish across systems, you've got to have a vehicle where partners from across the system can come as equal partners. I came from a system where the big acute provider was the big power base that had most of the resources and was as arrogant as anything, in terms of, well, actually, if it's kind of my way, the highway, as opposed to how do you enable a safe environment for those and other parts of a system to come to a table to genuinely be engaged at creating something different. And the really hard part about collaboration is someone has to give up something, or everyone has to give up a wee bit. So it's not, you're not there just to necessarily get some more resource off someone else, but actually that sense of actually there has to be something in all of this, something in this for all of us.
David, thank you very much. We're going to, so David, we'll stick with this theme. So we'll start, David, with you for the next one, then come to Geeta, and then Sam, which is third. I'm just to start that, David, I'm sure lots of people will be hearing you talking about big, powerful acutes who hold a lot of sway and thinking, well, I've never heard of that before. That sort of stuff doesn't happen in South East London, certainly. But your point, David, really interesting about how we start to incentivise collaboration and how we try and make sure that those behaviours are pointing in the right direction. It'd be lovely, David, to hear just a bit more about how you led the change in Canterbury and how you actually sort of starting where you were, how you tried to make those sort of practical changes to help people move towards a cross-system shared purpose.
Well, there's a couple of bits, and I was probably starting a strange space, but we did have three very simple strategic goals in place. One of them, first strategic goal, people taking great responsibility for their own health. The second one, people stay well in their own homes and communities, and that was more about primary and community care being the first point of contact and the main point of coordination or linkage with people. And we were trying to move create a health system where the hospital didn't sit in the middle of the health system. So the third strategic goal is people receive timely and appropriate complex care. And that was very much, again, the freeing up hospital-based special resources to be, if you needed to be in hospital and that's the right place to be, that was the right place to be. But if not, that was not, you should not be there. So the reason for starting off with three strategic goals is they give you the grounding to what you should be saying yes, assessing everything against, but more importantly, or as importantly, they also give you the reasons why you need to say no. If things don't match or add up to that, then you need to say no as a system, because actually generally health and social care, we're fantastic at adding a whole lot more dysfunctionality into things. We'll call them pilots, we'll call them projects, another tiny bit of funding that comes with whole lots of rules and exclusion criteria. And so part of that, again, is looking at how to provide a framework to be able to say both yes and no in a way that is, that is consistent and transparent, and that actually the system can understand why you've said no or why this is not important now. And we're not very good at doing that in health. And the other bit is I had a system that everyone were experts with their own little bit of data and using data as a weapon. We moved to a system of joined up data that was laid out in terms of a patient journeys from primary care to hospital and back. And we made data neutral on the basis that actually we didn't form any views of the data, but we let patterns emerge from that. And so it took all the emotive, antagonistic and biases out of the conversations to saying, actually, what is the data suggesting to us? And where do we now need to be kind of putting our attention to? And the final bit is I don't think health and social care systems need a single bit more data. You're drowning in data. The problem is that people don't know how to use it. And to me, that's the bit that's really, really lacking in just about every health system I'm seeing at the moment, is the ability to be informed by data as opposed to anecdotes. And that's a really important way of actually, by making that visible to the system, it actually is a great bit for actually underpinning building of trust.
David, lovely. Thank you very much indeed. Well, let's stick with this theme about how we can shift to work towards a cross-system shared purpose. But again, thank you for all comments in chat, and we're going to come on to just a couple of those points in just a moment, and please do keep them coming. Geeta, let's come to you next. So how do we practically do this? We're all sitting here going, yep, okay, all right, this is difficult. What have you seen which has worked? Where would you start in working towards shared purpose?
So I agree with what David was saying, that you need to ground things in your values, but you also need to get off the dance floor onto the balcony to make sense of things for people, and support people, give people cover to try out new things. That really helps. And one of the things that comes to mind is my journey in my leadership journey, where I was trying to convince a board about having a mobile macular unit, because my specialty is medical retina, and macular degeneration didn't have treatment, and suddenly there were injections available to treat it, and we didn't have the infrastructure to look after all those patients who were coming back every 4 weeks. And I remember going to the board and trying to present my idea of having a mobile macular unit going into the community. And I was given 10 minutes to present, and I could see that 5 minutes to the presentation, nobody was paying any attention, and they said, "Oh no, it's too complicated. No way are we going to be able to do this in the NHS," and etc. etc. And the thing I did was I actually went and had offline conversations and honest conversations with each of those board members, so that next time when I went and presented, actually they understood what I was trying to do. So I think choosing your battles is important, but actually having honest offline conversations, I feel, helps, because it always takes time when you're actually dealing with a complex problem. There are no easy ways of doing it. And although culture and history are the key, I always feel geography makes the difference here. And you need to expose that conflict, but you also need to at the same time and it helps you cherish your outliers, because they challenge you and help you move in the right direction, because you're so embedded in trying to sort that problem out. If you don't actually take a step back and let other people, it's that seed leadership again, where you're letting other people building those trusts and relationships, so that that they will actually be there going in that journey the same way as you, and holding on to that common purpose that you started out with. So I think that's, for me, is really important.
Geeta, lovely. Thank you very much indeed. Let's come to Sam. So Sam, again, sort of in a system where we can so easily prioritise our own individual goals, your thoughts on how we work towards cross-system shared purpose would be lovely. If you can shoehorn sort of a metaphor involving your dog, you get an extra point as well.
Okay, well, I can actually, yeah. So I'm going to take your challenge there, Rich. But first of all, I was thinking about this, and I think one of the I won't try and top what David and Geeta have said, because they've got real life examples. But I was thinking about purpose, and maybe moving from purpose for to purpose with. I think this sort of links in with the where David was going with data. We've got to start using our relationship with our teams, our staff, our patients, our communities in a different way. No longer are they the passive receivers of care. No longer are they just there to hear what we have to say. Appreciate all of you are now listening to what we have to say, but that relationship needs to change, and the purpose needs to be with them, not for them. And I think that is something about if you just change that slight perspective, it becomes a different sort of purpose. People can be part of that purpose. They can be involved in it, and it comes back then to when you are trying to sell that difficult idea, or you're trying to get people on board, you're trying to get that sort of collective sense of belonging. It's a different starting point to the conversation. And just bringing Nigel the Labradoodle into this conversation, he has no ego. He doesn't really care whether he's in, you know, he's lying there on his back with his legs in the air. He has no ego, that boy. And some of this is about leaving your ego at the door and just doing the right thing and involving the right people in the conversation. Do I get an extra point?
Congratulations, yes, you do. Very good, well done, Sam. And even it wasn't too tenuous, so extra points for that. Sam, lovely. Well, let's stick on this theme, and actually, it links really nicely to a point. Thanks so much for making it Faith in chat earlier about needing to shift the sense of feeling powerful by all citizens who feel the system really does work on their behalf. I think part of Sam, let's start with you, then Geeta and David. I think part of what gets people quite excited about greater collaborative working is what that sort of new relationship could look like with those who we are here to serve. So with our communities and with people who are working across, people who work and live across South East London. Sam, what would be your advice about how we can all be more intentional and authentic in terms of how we broker that level of collaboration with our communities?
So I think being authentic is interesting. So sometimes you can try too hard to be authentic. It's a bit like trying to be cool, and then actually the harder you try, the less you are. So I think there is something about going back to your values as an individual and as a team and as an organisation and sticking with those. I think the one thing about working with our local communities and our staff and the residents and our partners is to be honest and to follow through what you said you're going to do. So if there is absolutely no chance that you're going to get the feedback out within a week on a particular issue, don't promise to do that. Be realistic about what you can say, but actually if you're going to promise to do something, fulfill that promise. I think it's something about it's not enough just to hear what people are saying. That's not enough anymore. It's not just that warm fuzzy feeling you get when you feel like you've been listened to at an event. People want more than that now, and they're entitled to that. So I think there is something about thinking about how you would like to be treated yourself, and do the same thing to around when you're coming back to the people that you're talking to and coming and feeding back to. I think a purpose needs to be shared. I think that's what we're saying here, and you can't do that in isolation.
Lovely. Sam, thanks very much indeed. So Geeta, I wonder if you want to pick up this theme just about how we do how we make sure that we are engaging and collaborating with our communities, maybe more than we have been. But also just to pick up again another lovely point just from chat from Nathan, just about how blame culture can really get in the way here, and get your thoughts about how we overcome a culture of blame in order to support greater collaboration. And you're on mute at the moment, Geeta.
Sorry, I think this is really important for me. I think that, if you are when you talk about authenticity, you need to actually show your real self. So if you actually are vulnerable in front of your team, then your team feels that they have permission to be vulnerable to you as well. I think for me, it would be really, really hard if something went wrong with one of my team members and I hear about it from a third person. That would be really awful for me, because I really want my team to feel that they have that psychologically safe space where they can come and talk to me about their mistakes or their near misses or whatever that is going on, so that we can together try and make things better. And for that, you need to actually be authentic yourself. You need to actually talk about your failures, because whenever people look at leaders, they always think that it's a successful journey straight right to the top. And we often, like Brené Brown would say, often all our failures, because you don't want to think about it. But unless and until you actually have failed and you've learned to get up yourself, you can't actually mentor or teach somebody else to do the same. So I think that's really important. And so I often give this example of when I joined as the postgraduate dean in Health Education England, they were going through a consultation. So this whole team is going through a consultation. They've got a new leader who they know nothing about and who's never been in London before, because I worked in Canterbury and Sussex. And, so they had this sweepstakes going on, which was because the World Football match was going on at that time. Now, I know nothing about football. I know everything about cricket because I'm Indian and it's in my DNA. And I remember going and telling these guys, I picked France and Senegal as my teams. And I said, okay, guys, France is going to win. And they were like, they couldn't believe it. They said, do you know anything about football, Geeta? No, I don't know anything about football. But so and so goalkeeper in Argentina is great, this person. And the thing was that it broke those barriers between us and them. And I actually felt that they were now my team, who were ready to take on this consultation, take on this challenge. And because they knew that whatever I am is me. And in the end, France did win, and I'm off the sweepstakes chart. That's different, because they no longer allow me to join any sweepstakes. But what I mean to say is that it's important that as a leader, when you're trying to go into that space, you actually don't change yourself. Don't pretend to be somebody you are not, because that then does not give them the sense of integrity that you need when you're trying to solve something which is a long-term problem.
Geeta, lovely. Thank you very much. Indeed, collaboration told through football sweepstakes. I think is a best-selling book coming to a bookseller near you. Geeta, thank you. Well, David, I'm going to come to you in one moment, but then I'm going to do a last dash round all three of our speakers, as time is against us. So just for Geeta and Sam, just to give you a moment to prepare. The final question I'll chuck at you in a moment is just to think about, if you're going to pick one particular sort of super small action you think our system leaders could take to drive purposeful collaboration across South East London, what would that be? Sam, Geeta, if you want to put thinking caps on. Geeta, you mentioned cricket there. David, do you want to talk about cricket?
Oh, that was rather harsh.
Sorry. It's just this rare occasion. David, just very quickly, there's a lovely point in so two points just from chat. One from Laura, just about picking up your point, just about this parity of partnership being key. So again, just if you wanted to comment a little bit more about how you have built that in New Zealand, in Canterbury, that'd be lovely. But then also a point from Kate about, actually, we talk a lot about collaboration, yes, but we talk a lot about localism as well. And actually, are these two concepts at odds? I'm really interested in Canterbury about whether you had a dynamic of areas wanting to be local and not wanting to collaborate elsewhere. So whether that's something which came up as well. David.
I came from a system where no one wanted to collaborate. It was all about local and very tribal. And often that's often a starting point of many systems, is that people don't get a sense that they're actually part of something bigger. And what do we reward in health? We actually reward problems and crises. And so when things are turning to custard, we kind of recognise leaders that step in and sort it out. but they sort it out for that moment and that time, and the same issue happens the next day and the day after. And I think that's one of the big learnings, is to be really clear about symptoms versus problems. Health and social care, yeah, we often respond to symptoms. We often create solutions around symptoms, but actually that's not the problem we're trying to solve. And we've got to get better at actually understanding what is the real problem we're trying to solve, because health and social care is filled with some of the most brilliant problem solvers. However, we don't give them the right problem to solve. And therefore, we end up going this roundabout of people spending a lot of time and energy fixing a symptom, or where the latest bit of noise is, putting another band-aid on it, and think we've actually made, we've made progress. So one of the things that just on reflection, that as a leader, I thought my job to start off with many years ago was actually to solve problems. And I had some of the most brilliant solutions in the middle of the night. Could have solved anything. Would wake up the next day, and I was always puzzled why other people couldn't see the brilliance of my solution. And it took a wee while just to really understand that the biggest part is actually when someone else has your solution, it doesn't matter how brilliant it is. It's generally the conversation is here, but where were we in the conversation? And so that's something that became much more expert in, of actually not naming a solution. It sounds a bit counterintuitive. Always really clear about what I thought the solution might be, but as soon as you name a solution, you give and invite everyone into the room to tell you why it's never going to work. And when you have people in the room actually with the right problem, every time they came up with a solution that was 1,000% better than the individual that had created or come up with a solution. And in that sort of environment, if people own a problem and come up with a solution, they'll walk over broken glass to make the imperfect perfect. And that, I think, is still our biggest challenge as leaders, is how we continue to create that environment. Not respond to the symptoms or the noise, but actually that's often where people are shouting and ranting and raving, and you've got 17 ambulances sitting outside an ED. Yeah, that's a symptom. Just doing another quick set of fixes is not going to fix the problem. And we don't spend enough time really, kind of getting a head around that.
David, lovely, thank you very much indeed. So we are, time is sadly against us. So we will just before we allow our panel to return to civilian life, we will just go around and say just your final question once more. If there's just one particular action which you would advise system leaders across South East London to take to support purposeful collaboration, what would it be, as small as you like? Let's go Sam, and then Geeta, and then David can have the last word, and then we will show our appreciation and we'll move on. Sam, where would you start? What would you advise?
Sorry, I lost you there, Rich. Sorry.
What would you advise, Sam? Where would you start?
What would my advice be? So my advice would be for the system leaders to get out and talk to staff. I think there's some people who have some great ideas and looking to share those ideas, and just to hear what's being talked about, what's being said, to capture some of the enthusiasm and also engender some of that motivation and momentum. So get out and talk to the staff.
Sam, thank you very much indeed. Geeta.
So for me, it's about making a start. You need to start anywhere, follow it everywhere, and don't wait for perfection.
Geeta, lovely. Thank you very much indeed. And exactly echoing, just a lovely comment again from Kate in the chat. Geeta, thank you. David.
I'd summarise this in an old Maori proverb, is he aha te mea nui Aotearoa. What is the most important thing in the world? He tangata, he tangata, he tangata. It is people, it is people, it is people. And to me, if leaders can keep that first and foremost in their mind and thinking, actually there is a person at the end of care, there are people that are involved in delivering care, is probably a useful point to continue to create and enable an environment where people matter.
David, what a lovely note to finish from David, Geeta, Sam. If we could all show our appreciation, wherever we are, for our fantastic panel. Thank you very much indeed, everyone.